Welcome. This is the Health and Wellness Coach Journal podcast. I'm your host, Dr. Jessica Singh, the founder and CEO of the Center for Health and Wellness Coaches. This is a podcast for coaches to explore topics related to health, wellness, and coaching, sharing knowledge and sharing light. Dr. William Davis is a cardiologist and author of the groundbreaking #1 New York Times bestseller Wheat Belly, 3 other New York Times bestsellers, Wheat Belly Cookbook, Wheat Belly 30 Minutes or Less Cookbook, and Wheat Belly Total Health, and several other books, including Wheat Belly, 10-Day Grain Detox, Undoctored, and his most recent book, Super Body. He is also the author of the national bestseller Super Gut, a 4-week plan to reprogram your microbiome, restore health, and lose weight that maps out the damage that has occurred with the modern human microbiome and the specific actionable steps that can be taken to restore it to maximum advantage, which is the topic we'll be exploring today. Welcome, Dr. Davis.
Thank you, Dr. Singh.
It's so wonderful being here with you again. I know Wheat Belly changed my life, and then now reading Super Gut has completely changed my life and will change the life of my friends, family, and colleagues. Can you share what journey took you from writing and researching Wheat Belly to Super Gut?
Well, the whole Wheat Belly message came from my efforts to do a better job in preventing heart disease. So I go back maybe 30 years or so when I was still doing such things as aborting heart attacks, myocardial infarctions, by opening arteries, stent implantation, all the things you do in a cath lab. But when my mom died, she lived in New Jersey at the time. I was in Wisconsin. She died of sudden cardiac death about 4 months after her successful coronary angioplasty. And it was a vivid illustration to me that managing a disease like coronary disease in a cath lab was woefully inadequate. So I started to ask, how do you identify this kind of thing years ahead of time? Well, as you know, the conventional answer is treat cholesterol, which is absurd. That's ridiculous. Technology, we shouldn't even call it that, is so woefully outdated. It should have been discarded 50 years ago, but it continues because it's made $1 trillion for the pharmaceutical industry, even though it provides next to no, the smallest benefit, trumped up by studies paid for by the pharmaceutical industry and, of course, our gullible colleagues who buy this stuff from the pharmaceutical industry. Because after all, there's a sales representative in a 3-piece suit or miniskirt offering dinner and a free expense-paid vacation to Orlando. So that's the tactics of pharma. You know what? It worked. And so we have a world dominated by this nonsense. Anyway, so I asked, what could we have really done? Well, back then, this remains true largely today. The only way to really predict your potential for dying, heart attack, etc., is a coronary calcium score, generated with a CT heart scan. Now, back then, we had to use what's called an electron beam device, more recently supplanted by multi-detector CT devices. And it's a very nice device. People say, oh, it measures calcium. We want to know about the soft components. No. Calcium is an index of total atherosclerotic plaque in all its forms, soft elements, hard elements, fibrous elements, etc. We help do these clinical studies. If you take a low-fat diet, Lipitor 40 milligrams or equivalent, exercise, baby aspirin, beta blocker, all the things, what my colleagues continue to this day calling optimal medical therapy, it has zero effect. That score of the plaque in your arteries doing nothing goes up 25% per year. With optimal medical therapy, Lipitor, aspirin, etc., it goes up 25% per year. People start freaking out. And of course, my colleagues, sad to say, a good portion of whom are unscrupulous, they'll say, well, you need a real test, heart catheterization, so we can prophylactically, preventively stent or bypass your arteries, which of course is malpractice, but it's done every day. Because the temptation is too great, the money is too good. These inappropriate procedures are not the rule, but they're darn close. It's very common to do. You've likely seen this years in your practice. I saw it, of course. Well, I refused to accept that ridiculous answer. So I started to look for better answers. And it sent me down I zigzagged and trial and error and generated some of the science, used other people's science, and it led to a bunch of new lessons. For instance, the real driver of coronary atherosclerosis is the small LDL particle. That science dates back 30 years from Berkeley and San Francisco, for instance, University of California, from Hopkins, from University of Toronto, from the Texas system. There's more than ample data to tell us it's not cholesterol, this crude indirect marker. It's an excess of small LDL particles. So one of the questions I asked, what causes small LDL? And the science had been crystal clear for over 30 years. Wheat, grains, and sugars. The amylopectin of wheat and grains, and sugars, sucrose, fructose, etc. So I asked people to remove those foods, small LDL, measured by NMR usually, nuclear magnetic resonance lipoprotein testing. A very simple, cheap test, often not ordered because the primary care doc says, I don't know what that is. We don't order that around here. It's experimental. It's not experimental. I've been doing it for over 30 years. And someone drops their small LDL, say, from 2,000 nanomoles per liter, particle count per volume, to 0. In other words, it's not a little bit better. It's eradicated in the majority of people. There's some variation, of course. But when we did this, elimination of wheat, grains, and sugars for the purposes of eradicating small LDL and thereby gaining better control over their coronary atherosclerosis, this is when people said, you didn't tell me that I would lose 67 pounds. And it happened without effort. You didn't tell me my waist would shrink by 8 inches. You didn't tell me I'd get so lightheaded I had to stop my 2 blood pressure medicines. You didn't tell me my rheumatoid arthritis pain would be cut by 80%. I could stop 2 drugs. I stumbled by accident for purposes of reducing small LDL on this side. And so that's when I started digging. Why would going against the teaching of virtually all dietitians, the Academy of Nutrition and Dietetics, the American Heart Association, almost all practicing physicians, almost all nutritionists, doing the opposite, why would that yield dramatic and unexpected benefits in health? So at first I thought, there's something wrong with me. I must be missing something here. But the deeper I dug, the more it became clear. Not only was it bad, this idea of consuming wheat, grains, and sugars in the human diet, it was a lot worse than I ever thought. A lot of that science came from the agricultural and genetics research, and talking to farmers and genetics researchers, etc. Became clear that there had been things done to the wheat plant. Wheat was a problem for humans all throughout history, but its adverse effects were dramatically increased or amplified by some of the efforts of agribusiness.
Honestly, even some of the concepts, just like when you had the courage and strength to say why, just to ask why, that's what scientists do. Theoretically, that's especially in medicine what we're trained to do is to ask why, but don't even realize the influence of industry. Because, the first time someone tells you after you're taught for years and years about cholesterol that, wait, you've been taught the wrong thing, it's almost hard to believe it at first, even though it's the truth.
It took 50 years to brainwash the population. It's going to take another 50 years, sad to say, to undo this mess. And that's why your hospital celebrates. They celebrate the $80 million new wing for cardiovascular care. Over 80 million Americans take a statin cholesterol drug, and there's been no meaningful reduction in cardiac disease. In other words, all this time, effort, and money spent, people continue to die or require procedures because the efforts at prevention simply don't work. So I refuse to play that game. But it leads to a whole bunch of new ideas, and you start to realize that people are wasting a huge amount of time and energy on something that has nothing to do with heart disease. Yet the great thing is once you recognize how heart disease, there's other conditions here involved too, of course, type 2 diabetes, dementia, etc. But coronary disease proved to be the starting place for me, and it proved easy to control. It proved easy to reverse. That science, thankfully, over the especially last 5 years, has advanced considerably. We now know. So we've debated for almost 20 some years the value of omega-3 fatty acids, for instance, ever since Gissi Prevenzione came out in 2001 and suggested a 19% reduction or so in cardiovascular events with a low dose of omega-3s. And then there have been smaller studies with all kinds of methodological problems over the last 15 years. But finally, large studies, large expensive studies involving thousands of people and more meaningful doses of omega-3s. And now even better, 3 studies using CT coronary angiography. That is the old CT heart scan device, but now using 3D reconstruction of the artery, including all its various components, fibrous, calcific, soft. And it's become clear that omega-3s at appropriate doses of greater than 3,300 milligrams EPA-DHA per day not only reduce cardiovascular events, but also achieve regression. And in all those studies, because the prevailing standard is a statin cholesterol drug, all those people had statin alone versus statin plus omega-3 fatty acids at higher dose. Evaporate trial, Hearts trial, 3 in total, and the omega-3s achieved regression while statin drugs allowed progression. Omega-3s were shown to achieve regression, reduction of the fat or soft components, because that's the stuff that ruptures and kills you or causes heart attack. So that's just one of the pieces that has emerged to show us that this idea of reducing cholesterol, and in fact, as you know, omega-3s actually increase cholesterol measures like total cholesterol and LDL. So the whole thing is little by little fracturing and falling apart, but it's going to take another 50 years for this to be incorporated into common practice.
Well, I am so grateful that it did not take 50 years for you to put all these answers together to basically this is public health. You writing and doing research and sharing and being able to have these books. I read Wheat Belly fast, but Super Gut, I couldn't put it down. I finished it within like 3 or 4 days, and I literally felt like I was having a conversation with you, seeing all these effects from cutting out the wheat, grains, the sugar. And then you had described in the book what got you to writing Super Belly or figuring out the next point to go to was the gut microbiome.
The original effort involved diet, yes, but also other things. So modern life is characterized by deficiencies in numerous nutrients just because of the quirks of modern life. Most of us live indoor lives. We don't get sufficient sun exposure, thereby vitamin D and other things. We drink filtered water. We must. Water from rivers and streams has sewage and other things in it, so we filter it, but it removes all magnesium. So we addressed those things lacking in modern life. Omega-3 fatty acids, we can't eat all the fish we want, it's tainted by mercury. So omega-3 fatty acids, iodine, magnesium, that added a whole new layer also because those 4 common things, very pedestrian common things, synergize to minimize insulin resistance and inflammation, other drivers of coronary disease and other diseases. But it was clear that there was more we should have done. And so I started a basic program in helping to try people rebuild the microbiome, the gastrointestinal microbiome. High potency probiotic, fermented foods, fibers like onions, garlic, shallots, root vegetables. But it became clear even that was inadequate. People would have fabulous results with these basic efforts, but be left with something like this. They'd say, you know what? My rheumatoid arthritis is 70, 80% better. I'm off the biologic. It's saving me $3,000 a month in a copay. My pain is reduced. I'm off the prednisone, but I still have to take my nonsteroidal, my ibuprofen or naproxen every so often because I have minor flares. What am I doing wrong? Or I lost 73 pounds. My hemoglobin A1C as a type 2 diabetic dropped from 11.7, disastrous, to 6.3. Much better. Still terrible. Right? We're aiming for 5.0. And so this person finally addresses the microbiome and it drops to 4.8%. Or in other words, we saw further improvements in health, but it became clear the missing link was the loss of microbes. So we now know with good evidence, if you or I or your listeners take, let's say, several days of clarithromycin or amoxicillin or some other antibiotic, you wipe out literally hundreds of bacterial species in the gastrointestinal microbiome, and for that matter, skin, vagina, mouth, all the microbiomes of the body. But we lose hundreds from the gastrointestinal microbiome. And among those, not all microbes are essential, but there are many essential microbes. One of the first ones to emerge and got my attention is Lactobacillus reuteri, which is ubiquitous in humans not exposed to antibiotics like hunter-gatherers. They all have reuteri. Mammals, wild mammals, beavers, deer, moose, they all have reuteri. Almost nobody in modern humans has it anymore, even though 40 years ago it was ubiquitous even in humans. Some emerging science in animals suggest that restoration of reuteri, a lot of this effort came from MIT, Massachusetts Institute of Technology. They did some very elegant work showing that the restoration of reuteri to mice achieved dramatic effects. Restoration of youthful muscle, increased mating behavior, amplification of the immune response, thicker skin. Now, they used a commercial preparation to achieve that. A commercial preparation of Lactobacillus reuteri was a product made for infants because there was emerging science to tell us that restoration of reuteri reduced infantile colic and maybe modestly reduced the duration of diarrhea after an antibiotic. I got that microbe, but I saw it was made for babies. So it was a baby dose. So I reasoned we could take entire bottles every day, which is impractical. So I thought, let's ferment it. That's how microbes grow. They don't have sex like humans or other creatures. They just double themselves, asexual reproduction. So that's called fermentation, of course. So I fermented reuteri, and reuteri doubles every 3 hours at human body temperature, about, I said 100 degrees Fahrenheit, so it's easy to remember, but anywhere from 96 to about 104, something like that. So I chose 100 degrees as a midpoint and easy to remember. We do that 36 hours, allowing 12 doublings. We count the number of microbes. There's a laser assisted counting method called flow cytometry, and we get about 300 billion per half cup or 120 milliliter serving. And people start eating it, and I started to see a lot of the same effects being echoed in humans that were seen in animals. And that was the first example of the power of restoring microbes we've lost. And that list is growing. Lactobacillus gasseri, Bacillus coagulans, Bacillus subtilis, Lactobacillus brevis, Lactobacillus rhamnosus. That now it becomes almost unmanageable after a while because we get a lot of these microbes by fermentation into something that looks and smells like yogurt. It's not yogurt, if I should point that out to your listeners. I call it yogurt because it looks and smells like yogurt. You can't buy this in a store. The stuff in the store is something completely different. But at some point, people say, how many microbes can I grow? So we have yet to come to kind of a cohesive, broad strategy that saves you from having to cultivate every microbe you want. But one of the great things is some of these strategies, like cultivation of reuteri gas and inclusion of fermented foods, tends to cause bloom in other species. You don't have to restore everything. And I call those secondary probiotics. These are species like Fecalibacterium and Ruminicacacia that you can't get as a probiotic. You can't ferment as a yogurt because they die upon exposure to air. But you can get them by taking what I call primary probiotics, reuteri, gasseri, Leuconostoc mesenteroides, Pediococcus, all those crazy names, and they cultivate those secondary probiotics. So I think that's where we're heading. Concentrate on the primary probiotics, a handful of them, not all of them, and somehow over time, the microbiome is smart enough to begin to rebuild and restore some of those lost microbes. It's not quite clear how that happens, but it does happen.
And for those who have not yet had the pleasure of reading your book, which will be shared and broadly advocated for, would you mind just sharing with the listeners of this, so for coaching and healthcare providers, what they can walk away with from reading Supergood?
Well, a number of things, thank you, but an appreciation for what we've lost. Huge numbers of microbes. This is taking on huge importance. For instance, the oral microbiome. It's clear that the oral microbiome probably plays a role in colon cancer, for instance. There's a microbe called Fusobacterium nucleatum that if you have issues with bleeding gums or periodontitis or gingivitis, that this microbe overproliferates, then enters the bloodstream and then colonizes your colon. And the evidence is strong. It's a primary cause of colon cancer. So while your gastroenterologist is busy doing colonoscopies and patting you on the back and not talking about either the colonic nor the oral microbiome, if they really want to be fully responsible for trying to prevent colon cancer, they need to look at those two microbiomes also. How about the finding of Porphyromonas gingivalis and Fusobacterium in the brain of people with Alzheimer's disease? It's not quite clear if they're causal, but it is clear that people with dementia have brains filled with oral microbes. So that needs to be explored. In other words, the microbiome is far more powerful than we ever thought. We thought it was this thing that caused diarrhea after a course of antibiotics. But it's looking as if type 2 diabetes, coronary disease, rosacea, psoriasis, depression, suicide, anxiety, dementia, high oxalate levels, calcium oxalate kidney stones, hyperuricemia, gout, high homocysteines. These are all, to a huge degree, abnormalities generated by distortions of the microbiome. That's the bad news. And this is ubiquitous now. It's come to affect, I won't say all, but the majority of Americans now. It's worse here, I believe, because antibiotics are so freely handed out. But it also means that if we understand that, we at least have the start of some powerful strategies to rebuild the microbiome, thereby take back control over health.
It's still like so eye-opening because, with health and for anyone who goes into the holistic health and healing space, there's always this element of deep introspection, looking at your life and figuring out from within your path of healing. And when you talked about Belly and the analogy in the book of how we as humans have had in our environment outside, never once did I even think about my environment inside? And so when you made that analogy in the book, I was like, oh my goodness, this is so plain as day and so obvious, but not something that we normally think about in terms of the microbiome inside of us. And it's also kind of mind boggling to go through 4 years of curriculum in medical education or residency or any fellowship and not be taught this at all. And so I'd love if you could just share a little bit on this huge gap in medical education. So that way coaches and healthcare providers are at least aware of what they need to supplement.
So it's great because you've been battered and beaten by the educational and training process. You know what it's like. It's memorize this list of things that causes scleroderma. And it has nothing to do with nutrition. There's virtually no mention made. It has nothing to do with nutrient deficiencies like vitamin D. It doesn't cause disease, it allows disease. And of course, the microbiome. I think you and I come to the similar conclusion that if you really want to be an effective healer, you need to be an expert in nutrition, in the microbiome, in nutrients, and probably environmental issues too. If you do everything right, but you're exposed every day to BPA from your foods or so-called forever chemicals in other parts of your life, or you're using shampoos and other toiletries that have all kinds of phthalates and parabens and those kinds of things. So it really means the effective healer needs to be expert in all the things that matter in health. It's going to take a minimum of 2 generations for this to happen. And you know what? Taking a half an hour to educate your patient or your client on nutrition or the value of magnesium or how to cultivate rotari as a fermented food, the insurance industry hardly wants to pay you at all. And they may even say, Dr. Singh, that's not in our curriculum. We don't recognize that as practicing medicine. We're not going to pay you, as opposed to thousands of dollars for some procedure. So there's great incentive to ignore health. How do we undo that? Well, we hope that there's people like you who say, you know what I was doing in practice was wrong. It was inadequate. There's a role for it. Yes, of course. Car accident, fall down the stairs, of course. But for health, vigor, youthfulness, preservation of muscle, all the things that are important to youthfulness. If you and I went to John Q Primary Care and said, hey, doc, I know from large databases that people who lose weight die several years younger, including people who have bariatric procedures or take a pharmaceutical. We know with good evidence they're going to die several years younger. Why is that? And what can I do to mitigate that? John Q Primary Care says, I don't know what you're talking about. Even though that evidence is, you and I did not invent this. That evidence exists. And by the way, it's my belief that it's loss of muscle that is the pivotal issue. So if someone loses, for instance, 40 pounds with the latest GLP agonist drug, of that 40 pounds, 30 pounds is fat, 10 pounds is muscle. Stop the drug, because most people can't afford that forever. You regain all the fat, typically more, 32 to 34 pounds, almost none of the muscle. You're much more prone to all the complications of lost muscle, including you're much more likely to be insulin resistant, develop coronary disease, breast cancer, type 2 diabetes, dementia. You're more prone to falls, fractures, frailty, loss of independence later in life, and you probably shaved around 3 years off your lifespan. Yet that franchise, particularly with the GLP-1 agonists, is making hundreds of billions of dollars, or will make hundreds of billions of dollars for the pharmaceutical industry to abbreviate your life. And that's the situation we find ourselves in. Unless people like you come to the rescue and say, no, let's rethink this. This is not right. Let's take steps. Now, John Q Primary Care says, don't worry, Dr. Singh, don't worry. I have all my patients engage in resistance training. Does that work? No, it does not work. There's good evidence to tell us that, for instance, there's an NIH study that was done. People engaged in literally a minimum of 2 hours a day of resistance training and aerobic, as much as 4 to 6 hours a day. In unbelievable efforts, 6 days a week, calorie intakes of between 800 and 1,200 calories per day. I mean, terrible. But people do this, or I should say this, over time. They lose weight, but then regain the weight. That's because loss of muscle means reduction in basal metabolic rate. That is, for all practical purposes, a permanent effect. And even though there's an upfront benefit, there's a long-term deterioration in health. This is well borne out in the clinical evidence. Yet the advice to do such things is cut your calories, push the plate away, buy this program, get this smartphone app that says, you're eating because of stress. Go do something else, distract yourself, or take this drug to reduce appetite, slow gastric emptying. These things only work temporarily, yet they make a lot of money. How do we undo this? Why, as you're trying to do educating people?
You know that feeling that something was wrong, like you had just said, what we're doing or in conventional practice, as also obviously physician burnout is so widespread. And one of the most common root causes I keep seeing again and have experienced, and I'm sure we all have, is this dissociation in the ideal of what we thought being a doctor would be and what the reality is. And then not even having that education of business operations or the influence of big pharma or insurance through medical education. Then you try in residency to be a good doctor, save lives, do all the procedures you're supposed to do. All of a sudden you get out and you're like, why am I unhappy with my job? Why do I feel miserable? I can't even tell you how many times physicians will say, I don't believe in this. And now they're so far in it that it's, what do I do with my life? And so it's such a hard place to be in, but I cannot tell you how validating it's been. The only message I felt like I got from my soul towards the end before I switched was I used to feel like I'm selling my soul sometimes. I don't know where it came from. It was just strong from within. And that was despite being in the emergency room, having that fulfillment of you get to help people with trauma or whatever it was, even at the end of life, as you know, because all the things that got that person to that last moment where they're critically ill, 90% of them was preventable in the first place. And so everything that you're sharing is so relevant for every single healthcare provider, just to help bridge awareness as to what we are practicing and to help advocate more for truth and get to the root.
I hope somebody young, smart, and energetic like Dr. Jessica Singh takes the reins and says, you know what? It's time to revamp, to reconstruct medical, physician education, because the efforts at that have been so meager as to be meaningless. But wouldn't it be so cool to train a new generation of practitioners who say, what do you eat for dinner? Let's find out what your vitamin D status is. What's the status of your thyroid? Let's take a look at your microbiome. Let's look at how you're living at home. What are you using for toiletries? And what are you cooking in? All those kinds of things that are simply not the current concern of practicing physicians. Wouldn't it be cool if that became? So I hope somebody like you takes the reins to do that. And I think that'll be the catalyst for big change. It's going to take years, a lot of effort, a lot of time, a lot of money. But I'm hoping it'll happen.
I hope so too. I think it's also interesting when you talk about the change, and maybe somehow this is connected, but I was surprised because in the Supergut book, very early on, you had talked about how it starts in the womb and with motherhood. And then maybe I'm thinking about nurturing and whatnot, but I was really, really surprised. We learned about infant mortality, how the United States performs maternal health and everything. And then you talk about all of these gut flora. I was thinking about the regular OBGYN. And when someone delivers a baby, you had mentioned antibiotics given at C-section, antibiotics to prevent eye infections, all these things. And I was wondering if you could share a little bit more about the microbiome and maternal health.
This came to a head for me because I have a daughter-in-law who just literally 2 or 3 months ago delivered her third child. And they're all healthy. She has, by the way, terrible celiac disease. So there's that also. But I saw that despite having access to unlimited resources, multiple specialists, that no one talked to her about microbiome issues. And yet the microbiome is dramatically important. So for instance, if a woman loses the dominant microbe of vaginal health, Lactobacillus crispatus, she's much more prone, and which is common, by the way, because like Lactobacillus rhodori and other Lactobacillus species, it's very susceptible to common antibiotics. So if a woman loses Lactobacillus crispatus from her vaginal microbiome, she's much more likely to miscarry her child. She's much more likely to have a premature delivery, which, as you know, can be catastrophic. If a woman delivers a child at 28 weeks, it's going to have problems for a lifetime. Immunological, psychological, neurological difficulties. So if a woman can take steps to delay delivery to full term, assessing and or restoring crispatus, omega-3 fatty acids, the evidence is overwhelming that abundant intake of omega-3 fatty acids stacks the odds in favor of full-term pregnancy, even going to 41 weeks. That's very solid. Yet the average American woman gets close to zero. It's like double digits, omega-3 fatty acids. So there's that. There's also, how about Bifidobacterium infantis? That if a child doesn't have that microbe, It will not have normal neurological maturation. It will have a lower IQ. It will be more prone to type 1 diabetes, type 2 diabetes as an adolescent, autoimmune diseases, etc. The problem, of course, is mom should have Bifidobacterium infantis and give it to her child at birth and passes through the birth canal or breastfeeding or just contact. But what if mom lost it because she got antibiotics? Or if the baby does get it, but the baby got antibiotics? So all my grandkids have gotten repeated courses of antibiotics at birth and in the year afterwards. And so purposeful restoration of Bifidobacterium infantis in a woman who breastfeeds, because the advantage of Bifidobacterium infantis is that it allows the child, the newborn, to metabolize so-called human milk oligosaccharides in breast milk. So it does nothing if a child is formula fed. But if a child is breastfed and has infantis, it's able to metabolize and thereby have better maturation, better brain development, etc. Those are just two examples of the power of the microbiome in reproductive years. Now, the same is true later in a woman's life, that women can lose Lactobacillus crispatus, be much more prone to vaginal dryness, irritation, discharge, infection, bacterial infection, candida infections, fungal infections, much more prone to repeated urinary tract infections, to incontinence. And so it's become clear, for instance, that restoration of crispatus, and remarkably, a woman can take crispatus orally and it will colonize the vagina. There's nearness in the perineum, in the groin. And then it will, even more remarkable, will colonize the bladder. This thing we thought for years was supposed to be sterile. No, it's not. It has its own unique microbiome, and a dominant microbe in a normal bladder is Lactobacillus crispatus. Reduce urinary tract infections, reduce incontinence. By the way, for which the conventional solutions are terrible. They're terrible. Repeated courses of antibiotics. A woman's health deteriorates with every course. Surgical procedures that are very iffy for incontinence. Well, now it looks as if the microbiome solutions may not be 100%, but they're a big leap forward. And there are microbes that blunt the suffering that women experience during menstrual cycles, as well as some of the vasomotor symptoms of menopause, like Lactobacillus gasseri. Very like Reuteri, lost by many people, restore gasseri and the difficulties of menstrual cycles. Menstrual cycles have always been tough for ladies, but they're blunted. The intensity of cramps, bleeding, reduced. The intensity of hot flashes in menopause, reduced. So it's becoming clear that female reproductive health is, to an extraordinary degree, something that's tempered or modified or altered by the microbiome endometriosis, which I know ladies who've been through a dozen exploratory laparotomies for their endometriosis, only to have pain recur 3 months after the last procedure, go through it again. And each time, of course, just awful. It's physically and emotionally demoralizing, but it's become clear that SIBO, small intestinal bacterial overgrowth, where fecal microbes, normally confined to the colon, have been allowed to overproliferate and then ascend into the small intestine that's very permeable, and the trillions of microbes who live and die very rapidly release their toxic compounds that enter the bloodstream and then lead to... That's how, of course, microbes in the GI tract export their effects to other parts of the body, whether it's the brain for dementia or Parkinson's disease, to the skin for rosacea and psoriasis, to the joints as fibromyalgia, rheumatoid arthritis, or to female reproductive tract as endometriosis and the migration of endometrial tissue into the peritoneal cavity. All these things over and over again. It's looking as if the microbiome... And so if the doctor prescribed, let's say, a biologic, a non-steroidal, and prednisone for your rheumatoid arthritis or fibromyalgia, whatever, they failed to address a major causative factor, that is the microbiome.
Absolutely. One of the things that was also so eye-opening was when you talk about SIBO in the book too, just the high incidence in the population. And even if you think you're healthy, it could still affect you, how normal it is. And it's so unspoken.
Dr. Singh, I didn't believe it at first. I thought, no way. And in other words, I looked at all the studies, there's several dozen now, that ask this question. In condition blank, fill in the blank, what proportion of people can be expected to test positive for SIBO? Usually by hydrogen breath testing. That's one way to identify microbes in the GI tract. There's some other methods too. But let's put in the blank irritable bowel syndrome. So there's 60 to 70 million Americans with IBS, and roughly, it varies from study to study, but about 31% will test positive. Well, that's about 18 to 20 million people right there. How about obesity? What proportion tests positive? About 50%. So there's 110 million or so Americans with obesity. That's 55 million people right there. Let's go down the line. Type 2 diabetes, fatty liver, dementia, cognitive impairment, coronary disease, atrial fibrillation, fibromyalgia. There's some overlap, of course, obese type 2 diabetics. But we easily exceed 150 million people. Even then, I said, this can't be right. Until this device came out, the AIR device, AIRE. This was the original that measured hydrogen gas. And then this is a more recent device, measures hydrogen gas and methane. There's a very simple protocol to follow, but it boils down to being a mapping device. It tells you where microbes are living based on how fast you convert a fiber, like inulin, say, to hydrogen. So if it does so within a few minutes after you ingest some inulin, it tells you microbes are living in the stomach and duodenum and jejunum. If it takes a long time, say 2 hours, that's okay. That's microbes living in your colon. So it's a mapping device. Well, when I started talking about this, when it came out in 2018, invented by an Irish engineer in Dublin, Ireland, I was shocked that left and right, people were testing positive and the negatives were rare. So it may be worse than 150 million people. Some people may say, maybe the test is flawed. Maybe the whole idea is flawed. What I saw was people would test positive. They would take steps to correct the SIBO and thereby the endotoxemia, the entry of bacterial toxins into the bloodstream. And they would say things like, my fibromyalgia is now completely gone. My hemoglobin A1C, I was stuck at 6.3%, is now 4.7%. My weight loss plateau, I lost 73 pounds on your program, but I have another 48 to go. I finally lost it. In other words, I saw health benefits correlate with the normalization of breath hydrogen gas. Now, this is not to say that everybody who thinks they have SIBO needs to buy this device. It's great to have, but you can do this presumptively, because if the solutions are really awful, if I said, Dr. Singh, the solution is removal of the small intestine surgically, you would say, you better be damn confident of that, Buster, before you talk. But what if the solution, my solution, is something that looks and smells like yogurt that you make in your kitchen and costs a few dollars and gives you smoother skin, better muscle, increased libido, better social behavior, makes you happier? There's almost no hurdles, little hassle, little bit of expense purchasing the microbes. And that I call, by the way, SIBO yogurt. It's not yogurt, and I kind of regret calling it SIBO yogurt because it suggests that it only works in SIBO. It worked outside of SIBO, of course, but that has exceeded my expectations dramatically with people normalizing breath hydrogen gas.
One of the things I really admired about your book is you go straight to the science without tiptoeing around anything, the biology, physiology in a way that is accessible, regardless of what the reader's background is. And like you mentioned, SIBO yogurt or the steps actually providing, it's like you read all of this and you're like, oh no. And then you actually had the way to figure out a way forward, a way to mitigate it, to improve health that is accessible and not toxic or not relying on big pharma. And the courage of being able to do that, I think for me, that was one of the things that also struck as a healthcare provider, because often I remember when I switched, you get scared of giving medical advice or scared of doing anything for fear you go against the system. And then what a breath of fresh air it is to read this book and be like, wait, this is a clear way out. And, for anybody to try. And so I really appreciate the courage, the honesty, and the accessibility. And honestly, this book, Wheat Belly, and the work you've done is such a huge movement in public health.
Oh, thank you. I've always been interested in giving people very accessible, affordable paths, not big, fancy, expensive things. I grew up dirt poor as a kid. It was me, my mom, and 2 sisters, and we lived in a 1-bedroom house, literally with a dirt yard. I didn't even own it. We rented it for $100 a month. I mean, on the verge of starvation much of the time. So I know what it's like to not have the resources. And that was true for me for many years. So I empathize with people. And it really bothers me when I see people being exploited by the system, where people can have healthcare insurance, for instance, yet go bankrupt because of one hospitalization and it ruin the work of a lifetime. That really bugs me. And yet we have pharma people, for instance, putting billions of dollars into their pockets and their shareholders. We have ophthalmologists making $3 million a year salaries for doing minor procedures. This is just not right. And so, as you point out, there are things that people can do that are dramatically effective. Of course, the key here is to do these kinds of things as early in life as possible, and not when you have something you can't easily reverse, like atrial fibrillation or cataracts or cancerous growth. So the key is to do these things as early as possible, because as powerful as these strategies, including microbiome strategies, are, they're not absolute. If you have pancreatic cancer, sorry, it's too late. You had SIBO. By the way, SIBO is probably a major driver of pancreatic cancer. If you take a pancreatic tumor and DNA sequence it using more modern methods, you're going to find fecal microbes filling that cancer. Now, how did fecal microbes from the colon get to the pancreas 24 feet higher up the GI tract, 3 times the height of the room we're both sitting in? How'd it get there? SIBO, right? Small intestinal bacterial overgrowth with fecal microbes. We don't wait for that to happen. We take action when you suspect you have SIBO, or you test positive for H2 gas in the breath, or whatever. Or just do it, because it's not like this is rare. It's just, if you're a betting person, you should bet you have SIBO, because the overwhelming likelihood is, or if you don't have SIBO and you have a lesser form, let's say colonic dysbiosis, disruption of the microbiome but it's confined still to the colon. All the things we do for SIBO still work for colonic dysbiosis. And colonic dysbiosis is essentially the rule that it's a rare American who's not been exposed to 1, if not 30, courses of antibiotics, as well as other things, glyphosate, other herbicides, pesticides, chlorinated drinking water, emulsifying agents in food, preservatives in food, all the things that disrupt the microbial composition of your GI tract and elsewhere.
I was surprised too, especially when you talked about a leaf or any kind of NSAID.
NSAIDs, PPIs, proton pump inhibitors, H2 blockers, prednisone, birth control pills. Dr. Singh, if you invented a drug and took it to the FDA, there's no requirement that you assess the microbiome consequences of that drug. And so the vast majority of thousands of drugs, we have no idea if they introduce massive disruptions of the microbiome. They probably do. Many of them probably do, because the ones that have been tested, almost every single one has been shown to introduce dramatic disruptions. So the key here, of course, is to not scrutinize drug by drug, but to minimize reliance on drugs altogether. Question prescription for a drug, take steps like in these basic programs you and I advocate that reduce the potential for all the common conditions that are peculiar to modern people. And I often say the enemy of the healthcare industry is healthy people. Because if you're healthy, you don't need that prescription for Lipitor or naproxen or the biologic for $12,000 a month. You don't need it. Of course, you know this. I have a lot of my followers go into their doctor's office and they say, well, what drugs do you take? They say, none. No, wait a minute. You're 65. You have to take drugs. The doctor and his staff don't recognize health when they see it. And they say, well, how are we supposed to make money? If our patients are healthy, how are we supposed to pay the bills? So the enemy of healthcare is health.
It's so true. I have had that happen so many times. You go to the doctor and they're like, what meds do you take? And you say none, and then it's just blank silence. I was also wondering if you could talk about, you were also somewhere in the book had discussed about how obviously our behaviors also impact our gut flora, stress, all those things. How does circadian eating or intermittent fasting impact the gut flora?
Isn't that something that you and I, as biological creatures, your listeners, all adhere more or less to this rhythm of the earth, the day-night cycle, the diurnal rhythm, circadian rhythm, all that. Yet we've worked really hard to screw it up. We have things like night shift. In training, it's 3 o'clock in the morning. You're admitting some patient, and that's your 10th admission of the day, and you're probably not going to sleep, right? I mean, we have done a great job of disrupting the microbiome. Stress alone, of course. So some of it's mediated by disruption of the microbiome. Disruption of the microbiome mediates even further changes, like the loss of ability to provoke oxytocin release, the gut-brain axis via the vagus nerve. It screws up cortisol responses. So a lot of people have excessive cortisol responses either in the morning or elevated cortisol in the afternoon, which is a major driver of inflammation, obesity, and other health problems. And so people have common sense solutions. If you have, let's say, excessive cortisol in the morning or excessive cortisol in the afternoon or excessive cortisol at 3 a.m. that wakes you up, or you have failure to have the benefits of oxytocin, you have a big belly and you have sarcopenia or loss of muscle, You could do things like people saying, like, get better sleep. Yeah. Avoid stress. Well, good luck with that, right? Not so easy. Eat properly, exercise. Yeah. We all know this. We know you don't need us to tell you that. But what's great is the microbiome is proven to be the missing link. So, for instance, the restoration of those our friends, Lactobacillus rhodori, Lactobacillus gasseri, and a growing number of other microbes, by the way. Blunt abnormal rises in cortisol, borne out both in experimental models and now in humans. And so we see all the associated phenomena. We see a reduction in abdominal visceral fat. We see an increase in muscle mass. We see improvements in biomarkers like C-reactive protein, IL-6, IL-1 beta, TNF alpha, all the blood glucose, all the things. And so it's become clear, get better sleep. Try to minimize your exposure to stress. Exercise to reduce myosteatosis, by the way. That is muscle infiltration by fat. Do all those things. They're wonderful. But pay attention to the microbiome, and you're going to have even larger benefits. So it's becoming clear that the microbiome also oddly adheres to the circadian rhythm. Microbes themselves. Isn't that amazing?
Absolutely incredible. I was also curious because this came up, and I know we can all relate to this in some level, just having a loved one suffer through something, some condition that, was largely preventable, that we might have had that hindsight wisdom, and it's still not so easy sometimes to deal with. I was curious, just after reading about how you were talking about how just even birth through C-section, their gut flora is different than vaginal delivery. For those healthcare workers or for people who are working in a hospital environment, just by what they're constantly exposed to, the cleaning chemicals and the bacteria high incidence, I don't know if there's ever been a study to show if there is an increased incidence of SIBO or SIFO in healthcare providers, but I was curious what you've seen.
I think you're right. I think there's been no formal analysis of that. I wouldn't be surprised that if we assessed not just gastrointestinal, but also skin and perhaps other, there's an airway microbiome, there's a brain microbiome, there's a vaginal, of course, there's a prostate microbiome, a bladder microbiome. And more, it's proven that I don't know of an organ that has yet not been identified as having at least microbes that have kind of a microbial signature for various organs. To my knowledge, that's not been done in hospital staff, but it would be frightening to see. At the very least, we're going to see a lot of pathogens, of course, on their skin. It could be MRSA, it could be methicillin-resistant Staphylococcus aureus, could be a lot of fecal. This creeps people out, but hospital staff tend to be colonized on the surface with fecal microbes. Because you know what? Humans are filthy. We've got E. coli and Salmonella and Pseudomonas on our hands, on our skin, on the doorknobs, on our car keys, on our smartphones. To some degree, that's good. But unfortunately, in a hospital environment where there's a concentration of pathogenic microbes, hospital staff tend to be more colonized with those things. But to my knowledge, no one's done a gastro. That would be a very interesting thing to do, by the way.
It just came up inspired by your work. And just so I know you provide wonderful resources so people can help themselves through this and figure out what's going on and also figure out how to supplement or enhance microbiome health, and appreciated the products. You also gave the recommendations at the end of the book because like you had talked about commercial probiotics and how they don't list the strain and how the strain is so important. And so for the healthcare providers and coaches listening to this, any advice for finding credible resources or what to look for if you're looking to enhance your microbiome? What do they look for?
Part of my motivation, Dr. Singh, in writing Super Gut was the lack of prescriptive information. It's just inadequate to say, well, eat good, sleep, take a probiotic. These are the most ineffective and limited solutions. So I came up with recipes, how to make the rhodori yogurt. If you have a new baby and you want to make sure that child has bifidobacterium infantis, here's how to do it. And here's a way to increase the counts and amplify the benefits. If you're a woman, you want to restore crispatus. If you are someone suffering with arthritis, here's how to cultivate Bacillus coagulans. It reduces arthritis pain. All those kinds of recipes are in the Super Gut book. Now, I did a small clinical trial where we had some unexpected benefits, including what I believe is an increase in muscle mass and a loss of abdominal fat. So I started thinking a lot more about what I call shape and body composition. Because as you know, people who lose weight, whether it's by calorie counting or by a bariatric procedure like lap band or gastric bypass, or even a pharmaceutical like a GLP-1 agonist, these are all variations on the same theme, reducing calorie intake. And we know with more than ample science, when you reduce calorie intake, regardless of the method, you're going to lose muscle. A lot of it. And we know, like we talked about earlier, that leads to trouble long term: falls, fractures, frailty, loss of independence, and earlier death. Well, I think we may have stumbled on a way to preserve or even increase muscle. Personally, when I first started doing these things years ago, my early 60s, I gained 13 pounds of muscle and my strength increased by 50% over 3 weeks. Now, Dr. Singh, I don't know about you. I hate the gym. I can't stand it. I just hate the whole process. I go because they have nice machines. Otherwise, I'll walk and ride my bike. I'll go to the gym once a week, maybe for 15 minutes. And, get the hell out. Yet I gained 13 pounds of muscle in 3 weeks doing that. I think that's kind of an over-the-top result. Not everybody has that same result, but I think there may be microbially driven ways to improve what I call shape and body composition. Reduce abdominal visceral fat, the truly problematic form of fat, while preserving or even restoring lost muscle. Ladies say, I don't want to look like Arnold Schwarzenegger. Don't worry, you won't. What we're talking about is getting back the muscle you may have had at age, say, 29, because we lose muscle as we age. And if you made the mistake of trying to lose weight by one of those methods, you've lost huge amounts of muscle. So I think that the new argument is, what can we do to preserve or even increase muscle? Increase thereby basal metabolic rate, which gives you control over where fat is located, how much muscle you have. So that's the focus of this new book, Super Body. It's meant to restore a lot of the benefits, the advantage you had in your earlier years.
It's also redefining what super means and how it could be redefined to be optimal health at any stage or age. I look forward to reading your next book. And so, to wrap up for today, I'd love to ask you, what is your takeaway message for listeners?
Sadly, and you know this as well as I do, the last person you consult for health is the doctor. You need them if you break your arm. You need them if you have a catastrophic infection. You just got back from Costa Rica and you got dengue fever. You need them. But for losing weight, for beneficial health effects, for prevention of disease, I wish it wasn't true, but the last person to consult is the doctor. In most cases, we're talking about mainstream MDs for the most part. And it shouldn't be that way. But until this happens, which, as we talked about, it's going to take probably 2 generations, I hope in your lifetime, not in my lifetime, it's too soon, but I hope in your lifetime, you'll see medical education, doctor becomes an advocate for health, not a deliverer of revenue-generating procedures and products, but an actual advocate for health. Should that happen, that would be fantastic. But you know what? Most people don't have 50 years to wait. And so that's the value of what you're doing, and I hope what I'm doing, helping people understand that you have to take the reins yourself.
Thank you so much, Dr. Davis, for your time for this podcast. Thank you for listening. I appreciate you and value your feedback, so please subscribe and write a constructive review. If you'd like to be informed of new episodes and offerings and resources for coaches, sign up for our email list at www.centerforhealthandwellnesscoaches.com. Sending you warmth and light.